Thank you so much for joining me today. My name is Emily Lau, and I'm a women's cardiovascular specialist and clinical researcher at the Massachusetts General Hospital. I'm delighted to be here with you as part of the MGH Midlife Women's Heart Center Community Conference. I'll be talking about a heart-healthy approach to the midlife. I'm generously supported by grants from the National Institutes of Health and the American Heart Association. Let's first begin by framing the issue. Why is women's heart health important? Heart disease is the leading cause of death in the United States in both men and women. It exceeds that of cancer deaths and the next four leading causes of death combined. While deaths from heart disease declined in both men and women from the 1980s to the early 2010s, we have begun to see that rates of heart disease deaths have begun to rise again in the last few years. Despite these alarming trends, awareness that heart disease is the #1 cause of death in women is lacking. These are data from an American Heart Association survey study that asked women to identify what they thought to be the leading cause of death in women. In 2009, only 2/3 of women were able to correctly identify heart disease as the #1 cause of death in women. But 10 years later, awareness declined. In 2019, only 44% of women were able to correctly identify heart disease as the #1 cause of death in women. So as you can see, we have a lot of work to do, which is why I'm so glad that we're all here today to talk about such an important topic. Here's our roadmap for today's talk. First, we will talk about how your heart health changes during the midlife. Then we'll review how I and other doctors assess your risk of heart disease. Third, we'll talk about the steps that you can take to take charge of your heart health. And finally, we'll end on some ways to get involved in research if you're interested. So let's begin. Before women go through menopause, which typically occurs around age 51, they tend to have healthier cholesterol profiles and lower rates of heart disease than men. But after menopause, women begin to catch up with respect to heart disease. And by the time they reach their 60s and 70s, the rates of heart disease in women are on par with men. And as women reach their 80s, rates of heart disease are actually greater in women than men. These are data from an interesting study that looked at changes in cholesterol levels as women transition through menopause. As you can see, levels of the so-called bad cholesterol or LDL cholesterol were low before menopause and rise steeply after menopause. While the opposite is true for good cholesterol. Levels of good cholesterol or HDL cholesterol drop abruptly after menopause. We think this is largely related to estrogen's protective effect on cholesterol before menopause, but we are still teasing out the details about how estrogen influences cholesterol levels. Many women who go through menopause also notice that they begin to gain weight abruptly. This is thought to be due to increases in what is known as visceral fat. There are 2 types of fat in the body. Fat that lies underneath the skin, called subcutaneous fat, and fat that wraps around your abdominal organs deep inside your body, called visceral fat. Visceral fat is more likely to increase your risk of heart disease. And the reason is that we suspect that visceral fat makes more proteins that inflame your body's tissues and organs and narrow your blood vessels. In this study, researchers measured visceral or abdominal fat and found that changes in visceral fat were relatively modest for women before menopause. But during the menopause transition, visceral fat increased rapidly. After menopause, visceral fat continued to increase, but slowed down. Finally, measures of vascular health, like how stiff the arteries are, also change during menopause. Stiffening of arteries are a sign of aging and or diseased arteries. We can see here that arterial stiffness increases abruptly during the menopause transition, especially for Black women. All of these changes, cholesterol, visceral fat, and arterial stiffness, are all thought to contribute to greater risk of heart disease that occurs after menopause in women. Now that we've reviewed some of the major changes in your heart health that occur during the midlife, let's talk about what we do as doctors to assess your risk of heart disease in the midlife. So when I see a patient in the clinic who asks me what they can do to prevent development of heart disease, I first ask them a number of questions about their risk factors. for developing heart disease, like age, sex, race, ethnicity, blood pressure, cholesterol, diabetes, and smoking. While we can't change our age, sex, or race and ethnicity, there are a number of factors that we can modify, like blood pressure, cholesterol, diabetes, and smoking. Then, based on how many risk factors my patient carries, I classify her as either low, intermediate, or high risk for developing heart disease. For low-risk patients, we recommend lifestyle changes like a heart-healthy diet and exercise. For our intermediate patients, we of course recommend lifestyle changes, but we begin to think about medications like blood pressure lowering medications or cholesterol medications. And for our high-risk patients, we emphasize both lifestyle and medications. Now, there are also some additional clues for assessing heart disease risk that are not considered traditional risk factors. These include family history of early heart disease, which may be a clue to genetic risk, metabolic syndrome, kidney disease, elevated lipoprotein a, which is a special type of cholesterol, systemic inflammation, and autoimmune conditions like rheumatoid arthritis, lupus, or psoriasis. And a history of adverse pregnancy outcomes like preeclampsia or gestational diabetes and early age of menopause are also two additional clues or risk-enhancing factors that contribute to heart disease in women uniquely. Now, it can sometimes feel very daunting to learn that so much of your body and heart health changes during the midlife and after menopause. So many of my patients ask me, is there anything that can even be done to improve their heart health? And the answer is absolutely yes. There are lots of strategies to improve your heart health in the midlife. This year, the American Heart Association released a new checklist of measures for improving and maintaining good heart health called Life's Essential 8. These measures help lower risk for later life heart disease and stroke. The Essential 8 include eat better. We recommend eating whole foods, fruits, vegetables, and minimize saturated and trans fats. Be more active. The American Heart Association recommends greater than 150 minutes per week of moderate intensity activity, or greater than 75 minutes per week of vigorous level activity. Quit tobacco. And quit use of inhaled nicotine, including traditional cigarettes, e-cigarettes, and vaping. Get healthy sleep. An average of 7 to 9 hours a night is recommended. Too little or too much sleep translates to worse heart health. Manage your weight. The ideal weight is a body mass index, which is a ratio of your weight to height between 18.5 to 25. Control cholesterol. Make sure your doctor is checking your cholesterol levels. We want to reduce high levels of bad cholesterol. Manage your blood sugar. We now measure a lab test called hemoglobin A1C, which is a lab marker that gives us a sense of how your sugar control has been over the past 3 months. And finally, manage your blood pressure. An optimal blood pressure is less than 120 over 80, and high blood pressure is defined as greater than 130 over 80. Is there anything else that you should do as a woman? Well, we now know that what happens in a woman's reproductive history, like when she first started her period, or if she had any history of pregnancy complications, can all influence long-term heart health. So make sure your doctor knows about your pregnancy and menopause histories. Finally, as you heard several times during this talk, we still really do not understand how menopause influences heart health. This is an area that I am passionate about, and we are running a research study here at Mass General to better understand the changes that occur during menopause that may translate to greater risk of heart disease. Our study is called InMotion. We are studying how inflammation changes through the menopause transition and how those changes translate to greater risk of heart disease. We are recruiting 4 groups of participants: premenopausal women older than age 45, women who are transitioning through menopause, postmenopausal women, and a group of men who will serve as a comparator group for the other 3 groups. The study involves 2 study visits, 1 year apart. At each visit, we will obtain a history and administer a questionnaire, obtain vital signs like blood pressure and heart rate, height and weight. We'll perform a physical exam. We will then place an IV and perform a procedure called an endothelial cell collection. After the IV is placed and before it is secured, we will insert a floppy wire into the middle of the IV. and run it back and forth to scrape cells from the inner lining of the vein. The cells are sent to our collaborators at Boston Medical Center and then will be looked at under the microscope. From there, we will secure the IV and obtain blood work. Finally, we will perform an EKG and a cardiac ultrasound. 1 year later, we repeat the same study procedures again to see what has changed in that time. The study takes place in the main hospital at Mass General Hospital, and there's a small compensation as a thank you for participation in this study. And we, of course, validate parking. If you're interested in participating, please feel free to reach out to me, and we will provide more information at the Vincent Center for anyone who is interested. On that final note, just want to acknowledge the tremendous team of researchers and physicians that I work with, as well as my clinical partners at the Corrigan Minehan Heart Center Women's Heart Health Program at Massachusetts General Hospital. Thank you, and I'm looking forward to our Q&A session.